How do we determine cardiac axis? I do not remember mnemonic to determine cardiac axis because I forget mnemonic. So I remember in picture format. Like you can see this circle and these are the axis. So I have just zoomed this portion here. So see here. So this is 0 degree axis, this is minus 90, this is plus 90, this is 180 degree, and this is minus 30 degree, this is minus 45, this is minus 90. I hope you are now oriented to this picture. So what is the normal cardiac axis? Normal cardiac axis falls between this range. So it can be between plus 90 to minus 30 degree. If it goes beyond this until here, we call it left axis deviation. If the net vector goes in this direction from plus 90 to plus 180, we call it right axis deviation. And if it goes in this quadrant, then we call it extreme axis, right? So let's say in ECG, in any ECG, you saw that in lead 1 there is predominant positive wave. So if there in lead 1 there is predominant positive wave, means in lead 1 it is positive. So the vector is in this direction. And in lead AVF also you saw predominant positive direction. So here predominant means, if you see this is the baseline, so majority of the amplitude is positive, right? So from this baseline majority of the amplitude is positive. So if 1 is positive, AVF is positive. So 1 is positive, AVF is positive. It means that the axis is falling between this range, right? So this is normal axis. But let's say this is positive, but in AVF the predominant wave is negative, like this. Let's say AVF predominant wave is negative. So if it is negative, so this is positive direction, so negative direction will be this. So this will be the direction of AVF, because this is predominantly negative and 1 is positive. So 1 is positive and this is negative. So the axis falls between this range. So between this range, as I earlier told you that from 0 degree to minus 30 degree it can be normal axis, or between 30 to minus 90 it can be left axis. So here you have difficulty determining the axis, because this can be normal or this can be left axis. So how will you determine in that condition? So if you face this type of situation, then check lead 2. So this is lead 2. So in lead 2, let's say it is positive. In ECG lead you checked and you found like this, let's say. So predominantly positive deflection. So it means the net vector is in this direction. So if the net vector is in this direction and AVF is in this direction and lead 1 is positive direction, right? So here lead 1 is positive, this is in this direction and this is in this direction. So here you can see one vector is going in this direction and two vectors are leading towards on this side. So most likely axis of the heart will be in this range only. It won't go beyond this. But let's say if this lead 2 is predominantly negative, like this. So if the predominant negative, so the predominant vector will be in this direction, right? So this vector lead 2 is directed in this direction and 1 is in positive direction. AVF is in this direction, right? So now imagine the condition like this, right? So two vectors are going in this direction and one vector is in this direction. So if you sum up the magnitude of both, it is leaning towards on this side. That's why most likely the cardiac axis will fall between -30 to -90 degree or left axis deviation. So if you get confused, then check lead to whether this is positive or negative, and this will help you to determine whether the axis is falling between 0 and -30 or is it falling between -30 and -90.